Group 1, EBP, Response Elaboration Training by Dharma Tripp, Elizabeth Fisher, Lauren Beagle, Anna Davis, and Lexi Moon. Despite the numerous treatment approaches for aphasia clients, in Charles' case, it was decided that response elaboration training would be the most effective. What is response elaboration training and its purposes? According to Wamba et al. 2001, response elaboration training, or RET, is a patient-centered approach that is known for its effectiveness in increasing verbal productions with aphasic clients. More specifically, RET targets facilitating verbal productions by increasing the length of the utterance as well as improving the quality of content of their productions.
According to Husak 2011, during RET treatment, the clinician will reinforce what the client said, along with expanding and shaping the response of the client. This helps the client to produce a longer utterance based on their own response. The clinician will ask WH questions to help the client expand even more and will combine all the client's responses into one sentence that the clinician will model and the client will repeat. RET helps individuals with aphasia speak more fluently by increasing the amount and variety of the client's speech. RET follows a flexible approach which encourages spontaneous speech and gives the client freedom and control. By giving the client more control over their responses, they are able to guide their therapy and self-motivate to improve their communication skills. Clinicians can use stimuli that is of interest to the client, which will help with motivation during treatment. RET is primarily used for clients with non-fluent Broca's aphasia, but has also been effective for other fluent aphasias.
Implementation of RET in therapy. According to Husak 2011, RET can be implemented in therapy using visuals. For example, the SLP will present a picture or a drawing and ask the patient to describe what is happening in it. It's advised to choose a picture with minimal details, and that includes an action, similar to the photo on the right. The patient will then describe what they see. The SLP will reinforce and expand on the patient's response, and if necessary, provide an example of a full sentence. The SLP may provide additional support by asking WH questions. The patient will then repeat the full sentence when it's complete.
Why response elaboration training is the best approach. Firstly, according to Wamba et al. 2001, it provides more naturalistic communication. RET moves away from rigid, scripted responses by encouraging clients to generate their own utterances, making it more effective for real-world conversations. Secondly, according to Bunker et al. 2019, it improves use of skills in real-life conversations. Unlike structured drills, RET's emphasis on self-generated content leads to better carryover into spontaneous conversations. Lastly, according to Husak 2011, it promotes greater engagement and motivation. Since RET allows clients to shape their own responses, it keeps therapy meaningful and personally relevant, focusing on meaning rather than just accuracy, which is essential for progress.
An example of a case study. One study that was conducted involved 3 adult participants with chronic non-fluent Broca's aphasia. The adults received RET within sentence production tasks for 1 hour 3 times per week for a total of 12 sessions. Their responses to SBT were examined in 3 parameters: syntactic structure, grammatical appropriateness, and semantic appropriateness. Overall results from the study showed that all 3 improved in their performance on the SPT tasks utilizing RET. Transcriptions after RET indicated that participant sentences increased in length and complexity, while numbers of false starts and processing delays and their spoken sentences decreased, according to Bunker et al. 2019.
RET was deemed as the best treatment approach for Charles, and therefore other treatments are not recommended, such as constraint-induced language therapy, or CILT, and promoting aphasics communicative effectiveness, PACE. For constraint-induced language therapy, or CILT, according to Kermis and Maher 2010, it mainly surrounds the concept of using structured exercises to only improve verbal language communication. This would not benefit Charles as it's a constraint to only spoken language, and therefore it prevents the use of compensatory strategies such as gestures, nonverbal communication, such as shaking your head yes or no. And it is often deemed as intensive and demanding in the early stages of recovery as well. And it often decreases stamina in clients over time with the approach.
According to Davis, 1980, promoting aphasic communicative effectiveness has the client and clinician taking turns conveying what is on a stimulus card, either a word or a picture. The clinician is an active participant in therapy where the client and clinician are taking turns back and forth explaining the stimulus card. The clinician may remember stimuli and ignore what the client is trying to convey based on the stimuli. With pre-set stimuli cards, there is less room to choose stimuli based on motivating topics, where with RET, images can be chosen based on the client's interests, which helps with motivation in therapy.
And here are references.